Hello, dear friends. This is a 77-year-old woman who had an accident, a fall, and a full series trauma. CT scan was done. The patient had multiple injuries, but most importantly, she had an aortic injury, and I would like to discuss it with you. First of all, let's scroll the images up and down and try to make your impressions. I will show you the images in sagittal view. This is the sagittal view. This is the ascending aorta, the aortic arch, the branches of the aortic arch, and here is the descending aorta. And here in coronal view, so as the finding is very well depicted in sagittal view, we will discuss this finding here. So what we see here is a pseudoaneurysm, and additionally there is some haziness around the vessel, around the aortic arch here. Let's have a look again in axial views, and all this haziness around the aortic arch, which is extended downwards along the descending aorta, is abnormal. Actually, it's hemorrhage. Let's zoom in. I will go down, and all this abnormality stops somewhere in the distal thoracic aorta, and as we can see here, the vessel regains its normal appearance. Now, regarding the types of aortic injury, there are 5 grades of aortic injury. It is the minimal aortic injury, which is a simple aortic laceration, which is typically a tear in the intima. And by the way, let's have a look in the anatomy of the vessel, of the vessel's wall. Here is the intima. This is the inner layer. This is the thicker layer, which is the media, and the external, the outermost, is the adventitia. So in grade 1, the intimal tear looks like this in this image. In grade 2, there is intramural hematoma. In grade 3, a pseudoaneurysm is occurred. And in grade 4, there is complete rupture and extravasation. So in this case, we have a small amount of bleed, of hemorrhage around the vessel, around the aorta, and there is also a pseudoaneurysm. So this case is a partial transection and a pseudoaneurysm, or pseudoaneurysm and injuries to the outermost layer of the aortic arch, the adventitia. On the left side is the initial CT scan, and on the right side is a repeat CT scan 9 days after the accident, and as you can see, there is some improvement in the appearances. The periaortic hemorrhage has been absorbed significantly, as you can see. Here is the new CT scan. As you can see, the contour of the descending aorta is improved, however, the pseudoaneurysm persists. Dear friends, thank you for watching this interesting case. See you the next time.